athlete, big injury. According to the Consumer Product Safety Commission, every year there are 3.5 million sports-related injuries in athletes ranging from the age of 5 to 14 years old. We tend to look at these young athletes as small adults. However, that is not the case. As they grow, their muscles, bones, ligaments, and tendons are at a higher risk of injury because they are growing, which makes them weaker. Do you know a young athlete? Maybe your neighbor, nephew, niece, or maybe even your own child. It could be a basketball player, a football player, a cheerleader, a baseball player. What do they all have in common? The moment they step onto the field or court to perform, they are at risk. I have 2 sons that have played just about every sport that they can. And for the past 7 years, I have watched them practice or play 5 to 6 days a week. And I never thought anything could go wrong until it did. My 11-year-old son sustained a shoulder injury playing football this year, which has led into surgery. We do not know the outcome or long-term effects of this. A sports injury can be mild or severe, and it occurs whenever there is damage to the bone, muscle, tendon, or ligaments in the body. There are 2 types of injuries. One is chronic or overuse, and this happens when there is repeated use of the body part, which does not allow for time to rest. You normally see this whenever there is a young athlete that specializes in one sport and practices year-round, and it does not give their muscles adequate time to rest. An example of this would be Little League elbow. Another type of injury is acute injury. These are the injuries that are caused by sudden trauma to the body part. They usually include contusions, sprains, strains, or fractures. Overuse and acute injuries can both vary from mild to severe. In the long run, some young athletes may have their dreams of participating in a Division I college crushed because of the injury they sustained while playing their Pee Wee level sport. Some injuries can be devastating to the life of the young athlete. Some injuries are mild, meaning that they require little time for recovery or rehabilitation. An example of this could be a bruise or a strain. Other injuries can be devastating, requiring 1 or more surgeries, many months of rehabilitation, or even be career-ending, which means that it is no longer safe to return to the sport. Some of the devastating injuries can weaken the affected body part and prevent full functioning in the future. An example of these could be a fracture, a concussion, or a strain. While they are rare, catastrophic injuries in youth sports have a major impact on the athlete and their families. Although not all injuries are preventable, there are ways to help prevent the risk of some of these injuries. For chronic injuries, the best prevention is to not specialize in one sport. Give your muscles adequate time to rest. Rotate your sport with the season. For acute injuries, the best prevention methods are to limit your practices. Make sure you get adequate stretching before and after your game or practice. Make sure you wear the appropriate protective gear. Know and abide by the rules, and get adequate rest. Whenever you play tired, you are more susceptible to get injured. Nationally renowned orthopedic surgeon Dr. James Andrews stated that he has seen 4 times as many injuries in young athletes as he did 5 years ago. The types of injuries in young athletes can vary from chronic to acute, but the damage is still there. Your involvement in your child's preparation can make a world of difference. Now that you know more about what causes the sports injuries and how to prevent them, What will you do to help your young athlete when it is game time? If I say Joe Theismann, most everyone would automatically associate his career-ending injury that was shown on live television. Nowadays, most people have the "it can't happen to me" mind frame, so no one ever thinks of how a devastating injury would affect their lives. Knowing how common these youth injuries are becoming, hopefully you will be more aware when your little athlete takes the field.